Did you know everyone in the St. Louis area lives in a flood zone? Not a floodplain, but a flood zone, an area where there's either low, moderate, or high risk of flooding. Learn about your zone and understand your risk at knowyourzone.org.
You might not have thought about it, but the Metropolitan Sewer District is your health partner. This is Healthy You. I'm Sharon Stevens. In a minute, I'll tell you how the sewer company is keeping you healthy.
Did you know 1 out of every 5 flood insurance claims comes from an area not considered at high risk for flooding, and that the average flood damage claim is about $35,000? Learn about your zone and understand your risk at knowyourzone.org.
Who could forget 2020? We were locked down, shut in, and scared. COVID-19 was the deadliest virus of our lifetime. Today, COVID is perceived to be less serious, but due to its long-term effects, the virus is still a major concern. MSD Project Clear is committed to the health of the community, and the Assistant Director of Engineering, Jay Hoskins, is here to tell us why wastewater testing matters. Welcome, Jay.
Thank you, Sharon.
Let's start off by asking you the details of what you do.
So MSD Project Clear is the wastewater and stormwater utility in St. Louis City and St. Louis County. We serve about 1.3 million customers, and the engineering department has about 200 employees, and of that group, my team leads the environmental compliance efforts. And one of the things that we do is test wastewater. So when the Department of Health and the Department of Natural Resources asked us in 2020 to help with the pandemic testing, looking at how wastewater could be used to look at trends in COVID levels in the community, it made sense for us to try to help do that because wastewater testing is something that we do every day as part of our normal job.
That doesn't sound like something that people would find appetizing. Wastewater, what?
Yeah. Well, I think that my job is really interesting. And I went to school to be an environmental engineer. And when you go to school to be an environmental engineer, they teach you about all kinds of things like the Clean Water Act, the Clean Air Act, and how to work in different waste areas. And I never thought as an engineer that I would work in all of those. And what I find really interesting about my job at MSD is I get to work in all those different spaces. So for me, it's a great fit.
Well, tell us why people should be interested in Project Clear.
So MSD Project Clear is a wastewater and stormwater utility that really touches the community's efforts in so many different ways. So we handle stormwater runoff. So when it rains, the water has some place to go, and we make sure that it gets there safely. When projects need to be done to improve our sewer capacity for economic growth, we make sure that those sewers get sized correctly and that they're built and inspected to work the way they're supposed to work. So we're a job that not a lot of people think about until something goes wrong. And if you've ever had a basement backup, if you've ever had a problem with the sewer system, we're the folks that you should call first.
I gotcha. So how does this testing work?
So the way the testing works is that every day MSD samples wastewater that comes into our 7 different treatment facilities. We have 7 different wastewater facilities, and as a normal testing routine, we bring that water in and we test it for a whole lot of things. Mm-hmm. When we get those samples, then we collect a small portion of those, and we actually send those samples off to the Department of Health's laboratory in Jefferson City. And so we do that on a Tuesday, and by Thursday the state has results. So it's pretty quick turnaround time. And then those results, as far as COVID levels going up and down, those all appear on the state's website. They have a website that they use to transmit that information. And that goes out all over the state. It's available to the public, it's available to our city and county health departments, and it's used for a variety of purposes.
We're using the term wastewater. What's in wastewater?
Yeah, so the wastewater that comes into our treatment plants is a mixture of carbon, nitrogen, the waste products that come from people. And even with our industrial customers, we require them to treat their levels down to something that it's compatible with our wastewater treatment processes. So it contains the same things, a lot of carbon, a lot of nitrogen. In fact, a lot of people think about wastewater treatment as a resource recovery because carbon and nitrogen are valuable elements, valuable resources that now we're looking at ways that, how do we recover those and use those for different products? So really what we're doing is treating and removing carbon and nitrogen in a way that won't impact downstream waterways. And we're trying to figure out ways to do that as cost effectively as we can.
So what do you do with the information? I mean, do you issue a booklet? Do you go out and talk to various communities?
So we're a provider of the information, and then we give that information to the health department. So the city and county health department, they take the information, or the state health department, they would take the information as well. And then they use that and distribute that however they see fit. Right now, the best way and the way that they use most often is actually through the internet. So all of the testing results show up on an internet-based site. It's called the Sewer Shed Surveillance Project. You can Google it, the Sewer Shed Surveillance Project, and you can actually get real-time data every week. And if you talk to the folks at DHSS, it gets a lot of hits. Some are, and if the data is not posted in a timely manner, they will tell you somebody's always calling and asking, where is the data? So it's very timely data that's used by not just the health departments, but also the public to make sure they have the best information available.
Okay, so if I want to look it up, where do I go?
Go to the Sewer Shed Surveillance Project. Google Sewer Shed Surveillance Project, and the first link that you will see will be a link from the Department of Health and Department of Health and Senior Services, the website that has that link.
Okay, so not something.com. Just go.
Unfortunately, it's not that easy. Yeah, it's not the most convenient web address.
Okay, so now do people have you come out and talk to them about this?
I've had different interviews with different folks in the community. One of the things that we're really proud about our involvement with this whole effort in the broader terms that we call wastewater epidemiology is that prior to 2020, while this idea of testing wastewater was out there, it wasn't common at all. And today it is very common. And there's been a lot of interest in St. Louis as a community in looking at what is in the wastewater, to look at all kinds of different things. So we've had interest, of course, in COVID, and that was something that came about in 2020. Missouri and St. Louis MSD were actually some of the first utilities and states in the country to look at wastewater epidemiology. It's actually something that we received an award for with our partners, similar utilities in Springfield and Kansas City. So because we were some of the first adopters to get this wastewater epidemiology testing for COVID up and running, folks around the country said, you know what, if Missouri can do it, we can do it. And so now most states in the United States have some level of wastewater epidemiology testing for COVID, but now we're looking at all kinds of other viruses too. So you're talking about flu A, something that this summer got a lot of attention was looking at levels of flu in the wastewater and whether or not what's going on with different flu viruses. So that's something now. And now we're even looking at having some interest in looking at broad scale community type levels of illicit drug use. So talk about the fentanyl crisis. So we've had people ask about, well, what about fentanyl? Can we measure that in the wastewater? What could be used for as far as targeting resources to help with these kinds of issues? So a lot of things to be figured out, a lot of things to be worked on. The COVID testing, though, is certainly the most mature and most reliable. And that's one of the things that's so interesting about this project is that when we started doing the COVID monitoring, no one could really tell us if it was going to work. It was an idea, right? It was, at the time, if you recall, in early 2020, there wasn't a lot of there weren't enough COVID tests to go around in March and April of 2020. And so health departments really had a hard time figuring out, well, what is the degree of community spread? How many people actually are infected? And that need for testing is what borne out this idea of using wastewater to test wastewater. The first question is, could we identify the virus in the wastewater? Some really smart guys and gals at the University of Columbia, or University of Missouri Columbia, figured out that yes, it could be done that way. And once they were able to get the testing methods up and running, then they came to us and said, can we try you first? And we said, sure, we'll try first. And once they proved it with MSD, then we were able to prove it with other utilities across the state.
Now, how many other communities are taking part in this?
I don't know the exact number. I'm going to say around 100. And it raises in just in Missouri, in Missouri alone. The number rises and falls. Sometimes, particular cities have an interest and they sign up for the testing. It's not mandatory. It's not required. It's just something that, if a city or a utility thinks is something that's in their community's interest, they can sign up for.
Does it cost anything extra for you to do this project?
It costs us a little bit extra, but we're actually reimbursed for it. So there's a grant from the Sitters CDC that comes through the health department, and health department then disperses the grant to us. So our costs are offset.
Okay. How about my costs? Am I offset too?
Your costs are offset too. Yes. This doesn't cost MSD's ratepayer. This additional testing doesn't affect MSD's ratepayers at all.
Okay. How about some other states where this is an active project?
Yeah, so other states are doing this kind of testing too. California, New York, Texas. It's really, really common now across the country. Illinois. It's not, at the time, I think what we were doing in Missouri was novel. It's not novel anymore. It's really done across the country pretty uniformly. And the Centers for Disease Control, they track the information and distribute that information to all the utilities across the country, what's going on and best practices. I have a call once a month with these folks. They're really interesting, bright people that are working on this project and trying to make sure that the data is accurate and distributed to people to make good decisions.
Okay. Do you think that Missouri has like the best project right now, or are some others? Are you looking at some others and saying, hey, we should try that?
I think we have one of the best projects in the country. Yeah. I really do.
Okay. So tell me what you think about this personally.
What do I think about personally? I think wastewater epidemiology is fascinating. It's something that, prior to the pandemic, nobody really gave a thought about of how do we use wastewater to track disease. And I think it's something that if we can provide value to, then it's an extra value. It's really efficient testing. It really doesn't cost a lot to contribute and participate in this. So if it helps the community bang for the buck, I think it's something that we should invest in. It's something that I like personally because it's at least our testing is all done through the state and federal government health partners. So there isn't testing done through a private partner. It's the public's data. It's the public's wastewater, it's the public's testing, it's the public's data. And so it's available for everyone, and it's not particularly difficult to understand. You can look at a chart and see COVID levels have risen, COVID levels have fallen. I know what that means, right? I can make decisions about that for myself. So,
okay. How do you see this being used in the future? How do you expand it? Will there come a day when we don't need to have it?
I hope so, but I doubt it.
Yeah.
I really do. I think that if you look at all the things that are going on in the world, and the potential for impact of our systems to be impacted by some other global phenomenon, and the way we are related, people in the country and the world are related now, and the way diseases spread is completely different than it was, 100 years ago and even 10 years ago. Mm-hmm. So I think this testing will have a lot of value in the future, and I think because of that, our health partners are asking, our political officials to continue to fund these efforts because they realize there's value in the data, and they're really just now starting to get to a point where they can reliably test for a whole lot of things besides COVID that will be, useful to people and policymakers to make decisions.
Mm-hmm. What other things, such as what?
Well, I mentioned fentanyl,
yes.
and illicit drugs. That's probably the most promising piece right now. Mm-hmm. And where we're at on that is we don't have the testing methods that we can use to accurately test for these kinds of things. So that's a really important part of the science of this, right? Is that the science of when you do a laboratory test is making sure that when you test for something, that you are testing it, you're measuring it accurately, as low as you can and as accurately as you can. Mm-hmm. And you want to make sure that those results are repeatable. And that's a very scientific process because when we put data out into the the public space, we want to make sure that the public understands, we have confidence that if we tell you the number is 12, the number is 12, right? So that's where we're at right now with the illicit drug testing, is making sure we have the numbers where they need to be. We don't ever want to see that data be used for, some kind of a criminal investigation or targeting particular neighborhoods. That's not our intention at all. The intention is we have, 300,000 customers that serve one treatment plant. If we have the ability to test for illicit drugs in that one influence sample, what an efficient way of looking at the community level of drug use in that sample. And then from that efficient level, that efficient sampling result, a health department can just say, okay, does it make sense relative to our peers to spend more money for drug prevention, or whatever it is that they decide that makes sense for them. But we think that if it's something that they're interested in, and they're interested in having the data from us, then we're going to participate and try to help them do that.
Okay, thank you very much.
You're welcome.
Well, we may no longer be locked down and scared, but COVID is still a serious health problem. Wastewater testing by MSD Project Clear is a proactive health tool. Thanks for watching Healthy You by the Open Source. I'm your host, Sharon Stevens. Next time.